This conference will now be recorded.
All right, Nikki, just wanted to do one final sound check before we get rolling. Can you hear me?
Yes.
All right, thank you, and good morning, everyone. If you could, please keep your microphones on mute just to reduce the background noise. My name is Matthew Curran, and I am the Director of Food Safety for the Florida Department of Agriculture and Consumer Services. And joining me as your co-pilot today will be Dr. Serena Giovanazzi. And Dr. Giovanazzi is our recall coordinator for the Division of Food Safety, and she works in our Bureau of Food Inspection. So we wanted to share with you some information that I think you could consider exciting and a bit alarming at the same time, depending on which aspect you're looking at through this. And for a little bit of background information, I think everyone on the line is aware that the Department of Agriculture rolled out its food safety rules pertaining to hemp extract products for human ingestion on January 1st, 2020. And since then, we have been monitoring samples through our laboratories as they're collected in the field, and we've also been conducting inspections of hemp food establishments. And so we had learned several things since our kickoff on January 1st, and one of those we wanted to share with you today. Going into this program, we had some expectations of what we may see, and we knew that there would be some things that we were not anticipating. And today, we're sharing with you one of those. And as we go through, this is an in-progress development that we wanted to share with you, get you involved in, and have continuing conversations about. And as you can see from the title, this deals with heavy metals in hemp extract products. So our objectives today are to talk about hemp and hemp extract, in particular what it means under Florida law, and focus on heavy metals in those products. We will get into sample testing and how we conduct that and the results from samples that we found to date. Then we will talk about some conclusions that we've been able to surmise at this point, by no means final. As I mentioned, this is something that is in progress, and we're continuing to study as we go along, and then some potential next steps for how we can continue down this road, yielding a positive outcome. So this slide is pretty much 101 for everyone on this call. We understand that. But some specifics as it pertains to Florida law. Those of you on the line probably already know that marijuana, in particular medical marijuana, is not regulated by the Department of Agriculture. Rather, that's regulated by the Florida Department of Health. We do have a nexus with them in terms of permitting facilities manufacturing edibles for the medical marijuana program. They do have to have a food permit. Now, when you deal with hemp, we all know the difference between marijuana and hemp. Hemp does fall under the Florida Department of Agriculture and Consumer Services, and if it is designed for human ingestion, our Division of Food Safety gets involved. We also have in the department two other divisions that are heavily involved in this, with quite a handful of others that are less heavily involved. Those that are heavily involved are our divisions of plant industry and our Division of Agricultural and Environmental Services. Both of those two divisions. The first one handles the crop growth and growing of the plants, and our Division of Agricultural and Environmental Services, they deal with seeds and pet food and pesticide applications. Those are conversations for another day. So in Florida, as in most states, the hemp plants cannot contain more than 0.3% THC on a dry weight basis, otherwise it is considered marijuana. So everything that we'll talk about here has to do with hemp. Now in Florida, as I mentioned, Florida law states that there are compounds, hemp extract compounds that can be in products that can be ingested and produced for ingestion by humans. And that is where the Division of Food Safety comes in. If you are going to ingest anything, whether it's supplement or sustenance food, that falls under our Division of Food Safety and has to meet food safety requirements. So hemp extract is derived from or contains hemp. So no matter what part of the plant you are using, if you're extracting components or if you are grinding it in whole and part, it is considered hemp extract if you are intending it for human ingestion. And the third thing, it cannot contain other controlled substances, particularly THC or other drugs or components that are considered illegal under Florida law. So that in a nutshell is the definition of hemp extract, and that can be found in section 581.217 of the Florida statutes if you are so inclined to trace that down. So hemp extract as a food. Wanted to take a few moments here to talk a little bit about the lessons the food industry learned about 100, 125 years ago. Being somewhat familiar with that history, obviously not from living through it, but from reading about it, it is very akin to some of the things that we are encountering today in the hemp industry. So there are lessons that can be learned from the history of the food industry. So in particular, back when there were not many regulations dealing with food, there were unscrupulous businesses and there were unknowing businesses, those two not necessarily being the same, that ended up producing products that were either A, contaminated with food, or B, not food, and were sold to consumers as food. The contaminants may have arisen from a lack of understanding about harmful substances that carry through during the processing of food, or how food was stored, to flat out deception in inedible objects such as sawdust and dirt and things of that nature were placed into food products as a cheap filler in order to increase profit margins. And from that came our federal agencies, the United States Department of Agriculture and the United States Food and Drug Administration that later formed. Their goal was to ensure that consumers were able to purchase safe food products. Now, since that time, much has occurred, and most states throughout the country, Florida being one of those, has a state level food safety program that actually several agencies are involved with. And our agency, being one of those, works closely with those federal agencies that I mentioned to ensure that the food products that are manufactured and sold to consumers are done so under sanitary conditions and that they're free of contaminants. Some of the particular areas to be concerned with and that we will touch on throughout today are the sourcing of ingredients. So food is manufactured depending on the product through a number of different steps and a number of different vendors handling that product and manufacturing that product. It takes several ingredients, which you can see on any food product or on the ingredients panel, tells you what's in your food. All those ingredients are made from sources, and those sources are required to ensure that they are producing those sources, those ingredients, free of contaminants and under sanitary conditions. And they sell those to manufacturers who then combine those together, ultimately forming the finished products that we buy in our grocery and convenience stores each and every day. So those sources have to be approved. And you may be familiar with that approved source terminology from our rules if you have been asked to verify the approved source of any hemp products you have out there. Now, we won't dive into approved sourcing too much today. We are actually in the process of developing another presentation in our webinar series to discuss approved sourcing. So I will leave questions on approved sourcing and that discussion for that presentation, but there will be one coming soon, so your questions will be answered there. But it is important that you understand the general concept at this stage of an approved source. It means that it was manufactured under sanitary conditions in an environment that's free of contaminants, so that way you can be assured that your food products are healthy and safe for you to eat. One of the things that we will also be talking about today, which has been addressed in the food world, is packaging. The packages that store your foods, they may be stored for a short or long period of time, and they consist of many different materials, and they must be of food grade quality so as not to contaminate the food products through direct contact or through leaching over time. It is possible when inedible materials such as plastics and metals are manufactured, they can contain harmful contaminants that can be transferred into your food if they are not manufactured under proper conditions and free of specific contaminants. So the industry has vetted this out, the food industry in particular, and there are actually federal regulations that govern this. And so this is important if you are manufacturing hemp extract for human ingestion, as you must store these products in packaging that will not eventually render that product contaminated. So the hemp industry is new overall, and we all know the history of hemp and marijuana and the legality of it throughout time. I won't go into that today, but many states, including Florida, have recently allowed hemp and even marijuana to be manufactured and available for public consumption. And so Commissioner Freed's goal is to make sure that in Florida, quality and safe products are manufactured and sold to all Floridians. And so that is our job in the Division of Food Safety to ensure that is taking place. So as I mentioned moments ago, the hemp industry can actually look to the food industry to avoid reinventing the wheel. It's been there, done that, and so there's a lot of information that is there. So if you are engaged in the manufacturing of hemp extract for human ingestion, I suggest, if you haven't already, research this and read about a lot of the trials and tribulations that the industry has gone through, and that will save you and your company a lot of time and money moving forward. So the start of this presentation was designed to help educate. We're learning this too as regulators. As I mentioned, this is a new industry, as we all know, so we are trying to make sure that we stand up a program that's going to be successful, that allows the industry to flourish in Florida and allows consumers to be assured they're purchasing safe and quality products. And so this is a collaborative effort with the Department of Agriculture and Consumer Services as well as the industry. So while we are regulators, we are also educators at the same time, particularly in new areas such as hemp. So metals in particular. There are metals that are beneficial and there are metals that serve no nutritive value to humans. So if you take a multivitamin, or if you don't and you go to the store, you can look at the back of the supplement facts panel on the back of a package of supplements, and you will see several metals listed, in particular copper, iron, magnesium, zinc, and a host of others. Our bodies need a certain amount of some metals in order to function properly. Now, too much or too little can also cause adverse health effects, and so there's usually a range. But there are also other metals that have no value whatsoever. Arsenic, mercury, and lead are just three of those, and we will focus on lead today. So those metals serve no value and should not be present above certain levels in any of the foods that you consume. So when we deal with toxic metals, there are health concerns to be focused on here. So heavy metals can have neurological effects. Your body can place these metals into the brain, causing issues with the way your brain is functioning. When you get into heavy metals, you get into a chemistry, and chemical effects can be realized quickly, or they can be the ones that are what I call the sleeping giants. They can sneak up on you and appear 10, 20, 30, 40 years later in the forms of cancer or other organ problems, such as kidney problems. For females, they can cause pregnancy complications with and inhibit fetal development, which can, of course, lead to potential death, stillborn fetus, or developmental problems with the child that they may have to deal with throughout their life. And again, they can have acute toxicity or even death effects. Now, Dr. Giovanazzi is an expert in this area, so I want to turn the floor over for this slide to her to talk a little more in detail about some of the health effects that can arise from heavy metal exposure. Dr. Giovanazzi?
Thank you, Dr. Kern. Good morning, everyone. Thank you for joining this webinar. Also, I would like to plug in this slide, and I'll just inform you, and that Dr. Kern did already an excellent job giving you an overview on why we actually worry about toxic heavy metals in public health. And unfortunately, these heavy metals are oftentimes associated with poisoning in humans. And as I mentioned, the health concerns and effects that are due to heavy metal exposure depends greatly both on the amount and the duration of this exposure, but also on the age. Dr. Kern mentioned about pregnancy complication and fetal development issues. It is particularly of concern the fact that heavy metal exposure is particularly deleterious to young children and developing young human beings. Indeed, there have been reports showing impaired growth, mental retardation, learning disabilities, and other health or behavioral effects due to heavy metal exposure. In addition, as Dr. Kern mentioned, long-term exposure of this heavy metal can lead to lots of issues. Actually, toxic heavy metals can really affect every bodily system. Some metals, for example, lead, increases risk of certain cancers such as lung, bladder, kidney, or liver cancer. And cadmium and arsenic are well-known carcinogens. That is why heavy metals are regulated, especially with today's presentation, we're going to focus on hemp extract. Dr. Curran?
All right, thank you, Dr. Giovinazzi. Just so everyone knows, the sound on my computer just went out, so I am flying without sound. I'm having to use a teleprompter outside of my office. So we will navigate this the best we can to finish this out. But thank you, Dr. Giovinazzi. Okay, so moving on. So a little more on heavy metals. So heavy metals can be present throughout our environment in soils. They exist in fertilizers. There are areas impacted by pollution. So some of these areas, they're naturally occurring as well. So there's a multitude of different sources that can produce heavy metals. And we just have to be mindful of those type of areas, particularly when plants are grown. Now, the cannabis sativa plants, like many other plants, will pull up chemicals and metals and nutrients and so forth from the soil. And so the plants will typically take up anything it can find in the soil. Some plants are better than others. And they will accumulate and store these items, these metals, these nutrients in various parts of the plant. Now, nutrients that it uses to function, it will continue to process those, but things like our human bodies that it can't process, it has to put them somewhere. So plants will store these in either the leaves or various places where its systems will end up putting them, and they'll reside there pretty much for the life of the plant, or if there's some way for the plant to expel those. And again, that's plant specific. So what happens if a plant, in this case, Cannabis sativa L, is grown in an area that has heavy metals in the soil? It can take up those heavy metals and store them in the plant. And once the plant is harvested, it is then possible to transfer those heavy metals into the hemp extract. And that is just one of the sources that we'll talk about today. And what we've learned is that some people process the flower only when they extract the hemp from it, the hemp extract from the plant, and others use the whole plant. So if you use the whole plant and it happens to be concentrating those metals in a specific area of the plant, it is possible to increase the chances of heavy metal contamination in the extract once it leaves the extraction facility. So we, on our end, will regulate the amount of heavy metals that can exist in hemp extract in order to ensure that consumers are receiving a safe product. So we established these levels in Rule 5K4.034 of the Florida Administrative Code. And those of you that were involved last year at our workshops, this is where this rule was developed and then promulgated and became effective January 1st, 2020. So this rule establishes allowable levels of metals, residual solvents, pesticides, and biological contaminants that can exist in hemp extract intended for human ingestion. Now, wanted to note that the pesticide levels in the rule are not related to use or application. Those are two completely separate and independent things. And I mentioned that because we've had that question quite a few times, and I just wanted to be clear that the pesticide levels in our food rule are not regarding permissibility of use, application, or anything else. That is just what cannot exist up to that limit in hemp extract once we test it. Now, focusing on heavy metals. So the 4 that are currently listed in rule, and we are compelled by statute to adopt the levels that are promulgated by the Florida Department of Health. And we look at 4 specific metals in our rule: arsenic, cadmium, lead, and mercury. And you can see the concentrations vary depending on the metal. So contaminant levels, the limits, especially in foods, are typically determined based on a number of factors. And one is toxicity, another deals with relative consumption. Now, with hemp being a new product, the relative consumption levels compared to, say, tomatoes or cucumbers or apples or oranges doesn't necessarily exist. So if somebody is consuming a lot of a product, you may have an increased amount of certain contaminants that exist in your body until it can expel it. So this is something that is still being developed and studied throughout the country, but the health officials are working hard in order to continue to monitor these levels in order to set appropriate and applicable levels for these and other contaminants. So what happens at the division level when we want to look at what contaminants may or may not be in the sample? So our field inspectors, they exist and are located throughout the state of Florida, and they visit all food establishments that are permitted and inspected by the Department of Agriculture. So anybody that is selling food that includes hemp extract intended for human ingestion must have a food permit to operate and are subject to our inspections and sample collection. So our inspectors will go to a facility and they will collect samples. And in this case, they would collect hemp extract samples. Now they will package those samples up and they will put them on ice and they will seal them to ensure their integrity, and then they will ship them back to our FDAX laboratory here in Tallahassee. Once the samples are received by the laboratory, they inspect the package to make sure it has not been opened or compromised. They make sure it's through temperature, and then they introduce the samples into our laboratory system. They enter them into the database and then assign the test to them, and then the samples begin their laboratory life. So once the lab has analyzed a sample, and in this particular case, when we talk about lead, the samples are what's called digested, and they're put into an acidic solution, and they're heated, and that hot acid solution will dissolve any metals that are available from the sample, and then that digestate is then taken and run on what's called an inductively coupled plasma mass spectrometer, or ICP-MS for short. And what that does is it basically creates a plasma, and those metals give off a certain wavelength. Each metal has its own fingerprint. And so what happens is that sample is then injected into the instrument. It's the plasma, it's introduced into the plasma, and then in this particular case, you can look at the wavelength of emission, as I mentioned, or you can look at the mass of the sample. And lead is a nice heavy metal that is relatively free from interferences, and so the ICP-MS instrument is a very good, stable, and solid analytical technique to determine lead in a wide variety of different matrices. And so once the laboratory determines that lead result is valid and meets all the quality assurance and quality control checks and is reported by the laboratory, if it is determined to be violative, which means it is above the regulatory limit, then it is sent back over to our field inspection unit for determination and then action into the field. So what will happen is our field unit will go out and will stop sale that product, which what that means is that product can no longer be sold. And it has to be disposed of in a manner that's acceptable based on the type of violation. A copy of that stop sale order is also issued to the responsible party that is on the package itself. And that may or may not be from a location here in Florida, but we want to make sure that that manufacturer is also aware and that they've been made aware that they cannot continue to sell or distribute that product here in Florida. Now, if it's something like a high lead content in the sample, that product cannot be rendered safe for human consumption, so will have to be destroyed. So What brings us to our presentation today, and the reason why we wanted to focus on this particular topic, is that we have had a greater number of samples than expected found to contain heavy metals, in particular lead. So the first question that came up is, what is the source? Where is it coming from? Is there one or are there more sources of lead? So as I mentioned earlier, the hemp plant is a good scavenger, and it can harvest metals from the grounds in which it is growing. We also have to look at the extraction or manufacturing process. Are there metals that are being introduced into the hemp extract through that process? And finally, we look at the packaging or the container. Is the finished product also being contaminated by improper or insufficient packaging or container material? As I mentioned early on in the presentation, food packaging is important. You can make many plastics and metals that are not free of contaminants, which can contribute to contamination of the food product. So the packaging and the container that it's stored in must be of food grade quality. What are the solutions? How do we fix the issue or issues that are at hand? Well, the first step is by having this presentation today to engage you, the industry, in identifying things in your process that may be contributing to this. So for us, that results in enhanced testing, which may also be applicable for you, depending on what your business activities are in the hemp world, to do more enhanced testing, focusing on lead and other contaminants that seem to be prevalent. A stronger enforcement action as well. When we find violations, we want to make sure that the action we take garners the attention that we want. We don't want to take an action and nobody pays attention to it and then the problem still persists. So is it a question of the stronger enforcement action? I don't know. But industry collaboration is equally and probably more important in order to make sure that the industry is engaged in solving this problem. My experience has always led me to the conclusion that engaging the industry is a great tool to solve a problem. So that's why we are here today. So the sample results, what we found so far for lead is that it is the only metal contaminant at this point that we've detected above our regulatory limits, which our regulatory limit for lead is, again, 0.5 part per million in hemp extract products. So I like statistics, so we wanted to share a few of those with you today. So of the 137 hemp extract samples that we've tested, 9 have been found to contain more than half part per million lead. That may not seem like an odd number, but it truly is. So the highest concentration we found was 18.8 part per million lead. Well, what does that mean? Is that high, low, indifferent? So just to put that in perspective, in the environmental world, hazardous waste that contains more than 5 part per million lead is determined to be hazardous waste. So that sample that has 18.8 part per million lead has 3 times the level of the threshold for hazardous waste. And that's being sold for human consumption. I hope that helps paint the perspective of the issue that we're dealing with today. We've actually had 2 samples that were above these, what we call RCRA limits, that's Resource Conservation and Recovery Act for hazardous waste. So we've had 2 samples that we found on the market that had more lead in them than what is allowed in hazardous waste. It's determined hazardous waste is above that level. We've had a third one that was just below that threshold. So we really had 3 of those 9 samples were extremely high lead concentration. So more on the statistics side, 6.6 of all hemp extract samples analyzed and have found to contain more than half part per million lead. We wanted to look a little further at that, but that equates to 22% of all violations. So this is the second most common violation that we have found in potency, which means less than the advertised amount of CBD in the product. That's our most frequent violation. That conversation is for a different day. But I just wanted to paint it in perspective that lead violations are the second most frequent violations that we have found. So we also wanted to look further and see not just what we're seeing above the regulatory limit, but is lead present at lower levels. And this is important just to A, gauge what's out there, but B, if we are concerned with leaching from packaging, that's something that changes over time. We'll get into that a little more down the road. So in 24 of the 137 samples that we've tested, also detected, but
Have
below
to
the half
see if
part per
we have a
million
box
regulatory limit.
opened
So
up.
that means that it
Okay.
can still be sold, but lead is present
We'll
in
see.
those samples.
Because we've been selling the KN95.
So the lowest levels that we detected were 0.2 part per billion, or excuse me, 0.2 part per million, or 20 part per billion, and as high as 0.27 part per million, those that were under the regulatory limits. Again, we've had 9 that were over the regulatory limit. So our instruments can detect down. I think our detection limit is down right around 10 part per billion. So that gives you some perspective as to the level that we can detect up to the regulatory level. So in total, that was detected in 33 of the 137 samples tested, or 24% of all samples that we tested. What that means, roughly a quarter of the samples that we find have the presence of lead in them. Again, not all violative, but lead being present. So this further suggests that lead is a prevalent contaminant entering the food chain from one or more sources. So here's a graphical view of our lead results. And we laid them all out so you can see where that lead threshold is. And the ones on the right, where you can see those violative levels, ranging anywhere from just over that limit at 0.62 all the way up to 18.8 part per million lead. You see I mentioned the 6.5 part per million lead and the 4.7. Again, the RCRA threshold is at 5 part per million, which determines hazardous waste. So I'm going to introduce this slide, and I'm going to turn it over to Dr. Giovinazzi in a moment. But we wanted to find out what is the source or sources of this lead that we are seeing. So our investigation in conjunction with 2 different manufacturers suggests that lead is leaching, could be leaching. We don't know this conclusively yet, but it's suggested that it's leaching from the graduated dropper. And what we've noticed is a picture of the graduated dropper there, and it has black paint on the dropper. So it is not uncommon for heavy metals to be present in lower grade quality of glass that's used, as well as in certain paints. So if this dropper, which is inserted into the bottle and it stays there, that product has been on the shelf for a year, it's in direct contact with the hemp extract for a year. So it is possible that leaching is occurring from the paint and or from the glass. So we have notified FDA of these high lead findings. They are, of course, concerned with human exposure to heavy metal content. Even though they don't recognize hemp extract as a food, they understand that various states, including Florida, do. So they are engaged in several of these high lead sample investigations that we have ongoing. And we have been working with some other states to investigate this as well. And before I turn it over to Dr. Giovinazzi for further explanation, I wanted to point out that on some of these really high samples, we've noticed that they claim whole plant extract, which goes back to my earlier comment that if the plant is bioaccumulating these and concentrating it in its leaves or various other parts of the plant, and they are taking the entire plant and extracting hemp extract from that, it is possible they are concentrating the lead into the hemp extract versus taking the flower and running that through an extractor. We've also noted the term electrolytic blend being added to the hemp extract. And then that triggers attention from me because if supplements aren't made in a proper fashion, they have been known to contain heavy metals as well. So not sure the source of that electrolytic blend. That is another potential contamination source. So with that, Dr. Giovinazzi, I'm going to turn this back over to you to talk more about the slide.
Yes, thank you, Dr. Fern. I hope you guys all can hear me all right. It's quite stormy over here, so I hope I have sound and you can hear me clearly. So as Dr. Fern mentioned already, the 2 manufacturers that we have worked closely with, and in the graph, they are depicted in green and red. Both have conducted very serious investigations for determining what the source of this lead contamination was. And it was kind of surprising for the both parties, for us and the companies conducting this investigation, that actually was the hemp extract was perfectly fine However, when further testing was conducted, the graduated dropper was found to contain lead. In addition, lead seemed to have leached into the product over time. And we will demonstrate this in a later slide, and we'll look at this a little bit more closely. In addition, what I wanted to mention is that one of the two brands conducted further investigations and identified even other lots that were containing lead above regulatory limits due to the utilization of these droppers, and decided to voluntarily withdraw from the market additional 6 lots. And they were kind of all associated with this batch. So in total, the withdrew from the market the oil that was tested, the department, 3 additional oils, and also 2 vaping oils. So if we could move to the next slide, please. And hopefully, I know we are having some audio challenges. Hopefully, we can overcome that. Just bear with us. Could we have the next slide, please? Thank you. So we focused on the first 2 brands where we knew through the investigation we have information that most likely the contamination was leaching from the graduated dropper. We're still, we wanted to inform you that we are still conducting investigation on the other 4 samples. Those are coming from 4 different brands. We are still questioning whether maybe it's the hemp extract. So we are awaiting extract testing results, or whether it could be, even in these cases, the container information. Is it the bottle? Is it the dropper, as in the other cases? But in addition, I wanted also to mention that we also have I'm so sorry, I lost sound for a second, my internet connection. I will repeat my last sentence. So we are still gathering information about the samples, about the 4 that are in the black box over there. And one of these hemp extract was involved in our nationwide recall because of the amount of lead and because of the doses that were advised for the consumer to undertake. Next slide, please. Thank you. So we have had additional insight also from non-violative samples. Dr. Curran earlier mentioned that we had about 24 samples that were below the threshold, the 0.5 ppl lead threshold of our regulatory limit. So there are 2 main things I would like to point out. So you see in this graph, each bar represents a different brand and a different oil that we tested. We have 5 arrows, 2 orange and 3 blue. Those represent 2 different brands. Let's call it the orange brand and the blue brand. However, these 2 brands share the same manufacturer and or packer. And these were found consistently to have this low level of lead. So the first thing that we'd like to point out is this is probably, we are seeing some recurrent findings with certain brands. However, this is not exclusive. And lastly, I would like also to mention that these are lead findings at the moment of the sampling. And as we learned from the 2 manufacturers that conducted investigations on the graduated droppers, we know that lead leaches into the product over time. Indeed, I want to show you the next slide with the results from one of those 2 brands. Next slide, please. Thank you. So these were results that were provided by a third-party laboratory regarding one of the two brands where we originally found the lead into the product. So this gives you an idea of what had happened with that extract. So the Hemp extract was tested beginning January 2019, and the testing level was below the 0.01 ppm per lead. This extract was tested again in April 19, and over time, the lead level had increased at 0.5 ppm. This is just below our regulatory limit of 0.5 ppm. In January 2020, we pulled one sample, we found it to be containing lead, and the company tested again one of the retained products, and it tested at 0.8 ppm. This shows you that in the arch of on a time span of 1 year, the hemp extract lead levels had increased about 100-fold. And again, the company tested the dropper, and indeed, the leachability test conducted on the dropper identified the dropper was actually the product that contained lead. Next slide, please. And again, we apologize for the little delay and for the sounds issues. But I wanted just to quickly conclude our what our data is bringing forth in our statistics. And I will bring this again to Dr. Kern. So we've tested about 137 samples, and we found that about 70% of these analyzed samples were violated programs, which made up about 22% of all violations. And about a quarter of the samples that were tested contained some level of lead. And as I mentioned in the previous slide, we did have seen some recurrent findings with certain brands. However, this is not exclusive. Dr. Kern, I would like to bring this back to you, and in case you would like to add further consideration to this few slides. Thank you.
All right, thank you, Dr. Giovinazzi. So, summing everything up, again, we have non-violative products. These products were removed from commerce in Florida. Again, we don't want consumers to purchase products that have greater than the allowable limits of any contaminant, lead being one of those. 6 products were withdrawn from the market. We appreciate industry collaboration. When we get to these points, they can reach out to their contacts, either their consumers or their retailers, and pull these products back. There was one nationwide recall that happened as well. So we do appreciate that effort from the industry when we do run into these problems. It is help all the way around the horn. So that type of assistance is greatly appreciated and encouraged. So again, potential sources. As we've outlined, there are several. And in dealing with these products, there may be one or more that are contributing to it. And they're also potentially time dependent. If we're dealing with a leachate, that can increase over time. So a product sampled a month after manufacturing may appear to be fine and less than the regulatory level, but if it is on the market for 6 months to a year, that can change over time if the packaging material, the glass, dropper, what have you, is contributing to the lead contamination. So that is a difficult thing to monitor as well. one way to address the packaging issue is to make sure that you are buying your packaging and any material that is coming in contact with the food from a supplier that ensures it is of food grade quality. We also mentioned the plants being a potential source. So this gets into understanding where your plants are being grown, what the soil content is around it. Knowing that information will help to determine if your plant is taking up any sort of contaminants such as lead. And if the contaminant is not present, your plant can't take it up. And also during your extraction and processing activities, ensuring that you are using components that are compatible with food and will not contribute themselves to contamination. So you would not want to use necessarily the same materials that you may use in a car engine, hosing, tubing, and metals that you would use in a food grade operation. So you want to make sure that the equipment you're buying is being purchased from someone that is paying attention to food grade quality materials. So the next steps, as we mentioned earlier, enhanced lead testing, not only by the industry, but by us as a department to make sure that we identify those products that are out there and we remove them from the market. And if the industry is doing that simultaneously, that just speeds up the process to make sure that consumers are receiving a safe and quality product. Stronger enforcement action against those that don't comply. Typically speaking, those that don't comply usually don't come to the table like you all today. So they are harder to get their ear sometimes, but stronger enforcement action is one way to get their ear. We prefer industry collaboration and a joint effort to get that done versus stronger enforcement, but that tool is in the toolbox if it is absolutely necessary at the end of the day. Following this presentation, we hope that there continues to be dialogue with everyone on this call and others in order to help identify these sources and change the sources so that we can eliminate the contamination. Again, wanted to pay special appreciation. I'm very proud of our Bureau of Food Inspection, our Bureau of Laboratories, for the work that they have done helping to stand up the food component of this program. They have put in countless tireless hours to vet through all of these different issues and take on all the challenges that arise. When you stand up a new program such as this, there are a plethora of unanticipated hurdles to encounter, and we have to deal with those quickly and accurately. So I would like to thank our teams for their dedication to this and their hard work. With that, we would like to open the floor for questions, but I do want to ask that you give me at least a 10-second lead to get to a computer where the sound is working so I can hear your questions. And I will step out into, actually, our computer is coming into my room. So if you give me 10 seconds, we will turn the floor over and open it up for a few questions. Okay, we're going to try this and hopefully we won't get a lot of feedback. But if you have a question, please unmute yourself and ask your question.
They're just going to ask the question in the chat.
Okay, Nikki, that'd be fine.
Okay, Dr. Kern, I can actually, we have a question in the chat box. I can read that for you. The first one is, what is the process when testing for heavy metals? What is the process when testing for heavy metals is violative? Is retesting an option?
So I'll go ahead and address this one. When we test samples in the lab, we run them through a rigorous set of processes, including quality control packages, to make sure that the result is accurate and definitive, and it is not reported until such time. So if there's any retesting that has to be done, we would do that prior to reporting. So once a sample is reported, the laboratory has determined that it meets everything and that the result is solid. So our next question is, why are there no standards for nickel and copper? Copper is found in high levels in red clay soils. This is a question that we have been asking the health officials for an expanded list of metals. And if you look at other food products and environmental sampling, you see a broader list of heavy metals. We all know that there are more than just 4 heavy metals, but at this time we are relegated to adopting the limits that are established by the Florida Department of Health. And I think that more studies need to be done to determine what appropriate levels would be. But this is a very valid point and one that we hope expands in the future. Next question is, were there samples that were positive from specific countries or foreign countries? The answer to that question is yes, and I will let Dr. Giovinazzi elaborate further, as she is the point person that has been gathering this information. Dr. Giovinazzi?
Yes, sir. Again, very great question. My answer would say it depends. So, as you may well imagine, every component in this extract may have a different manufacturer or a different origin. So yes, for some of these, the extract was coming out of the country. For many others, the extract was made in US. Packaging, however, in some other information, we may not know or have this information right now, but it is possible that some of the sourcing would be from out of the country.
All right, thank you. Our next question is, how do you see more industry collaboration coming into play? Committees, additional meetings, etc. The answer is yes to all of the above. So we are members of ASTM International D37 Committee on Cannabis. This is a consensus organization where involvement from the industry, whether from the industry, general public, regulators, everybody gets involved and discusses these issues as to how to handle things, set standards, testing methods, etc. Committee meetings, this is one of the committees. AOAC has taken on developing test methods for cannabis testing as well. Additional meetings with the department and the industry are definitely other options moving forward. And with the general awareness by the industry, if they are paying attention to, in particular, to lead and other contaminants that are of particular sensitivity, through internal testing, these sort of products may not make it to market, which would be ideal. So there are a multi-pronged approach to collaboration with the industry, and we are certainly open to other options as well. Next question is, will this webinar be recorded and available? The answer to that question is yes. Ms. Nikki Donner will make that information available and how to access that following this presentation. And the next question is, what is the cost for testing? That is a question that we cannot answer. We do not do private lab testing or for quality assurance purposes for companies. There are private labs out there that conduct this testing, and those labs would have to be consulted for their particular fees. Our work is done as a regulatory measure to check to make sure that the products out there are meeting the regulatory standards. So we do not take samples from the private sector for a for-fee basis. Our samples are scheduled with our Bureau of Food Inspection and our Bureau of Laboratories working together to determine a random sampling pattern throughout the state. All right, that was the last question we have in the queue. I'll give it another moment in case someone wants to type in another question. All right, a couple more just came through. This meeting seems to have focused on lead. Any other last thoughts on cadmium, mercury, and arsenic? So we focused on lead because that is the only metal that we have found to be volatile so far. We do look at cadmium, mercury, and arsenic, but have found no violations in that regard. So the products do seem to be well in compliance for those heavy metals. We also have expanded to some broad searches to see if other metals outside of those 4 are popping up, and we did not see anything that stood out. Those are things we will continually monitor as time grows on. And if we need to make any changes to our rules because of the presence of certain metals or other contaminants, we will look to do that through the rulemaking process. Just some comments to reiterate here. We have paid in Florida for heavy metals testing $95 to $100, just to share that information. from one of the viewers. Thank you, great presentation. Thank you for the feedback, much appreciated. And next comment for heavy metals testing, do you think ICP OES works as good as ICP MS? That is dependent upon the metal. For lead, I would recommend ICP MS. You can use OES as a technique. There are more interferences for the lead wavelengths versus the lead mass in ICP MS. Cadmium is another solid one through ICP MS. Arsenic has interference both optically and mass spectrally, so you really have to base it on the type of metal. We do have both capabilities here, and that is a nice tool to be able to use when you have a detect on one instrument to run it on another technique and get the same result. That is great for confirmation purposes. So another question, besides the document stating the packaging is food grade, what else can we ask for to verify safe packaging? If the company is currently producing food packaging for non-hemp food products, that's a good indicator. You can ask to see if they meet the CFRs for food packaging materials. If they're a company that is doing that and is engaged in other food commodities, that's a good indicator there. Specific questions, you can always contact our Bureau of Food Inspection at 850-245-5520, and our experts will be happy to walk through some of those details with you. But please reach out. We're happy to assist with more detailed questions there. Has Florida established parameters for acceptable soil levels of these 4 heavy metals? If so, what are they? That they have, and that is a question for the Florida Department of Environmental Protection. There are environmental soil cleanup target levels that are published. Off the top of my head, I do not recall what they are, but they are regulated by the Florida Department of Environmental Protection. And if you need contacts over there, please email us and we will try to place you with the appropriate contact at DEP. And some other great feedback. Thank you for your comments. We are glad you enjoyed the presentation. I will give it another few seconds here to see if there are any additional comments to appear in the comment box.
If you would like a recording of this presentation, please email cannabis@fdax.gov. Again, that is cannabis@fdax.gov.
All right, it looks like we are done with the comments, and I would like to thank everybody for their time today. Please don't hesitate to reach out for questions or comments or collaborative ideas. We are, again, in the process of learning ourselves and developing this as we move forward to make sure that the industry in Florida is solid and robust and is producing safe products for consumers. So thank you all for your time. Nikki, we will conclude the presentation there.